you thinking of using finasteride or minoxidil to deal with your hair loss? In this video, I'm breaking down the 5 most common side effects that people report with these treatments. 2 bits of information I'd like to share before we get into this video is number 1, side effects do not happen to everyone. In actual fact, side effects only happen to a minority of people who take these medications. And number 2, it's really important to note that with minoxidil and finasteride, it can be effective in the very early stages of hair loss. If your hair loss is moderate or more progressed, it will not do a great deal for you and you will not get results. And if you're at that point, I always recommend looking at other solutions, be they hair systems, which is something that I wear, or hair transplants, or maybe even SMP. But of underlying importance, ensure that you do your research and that you're open-minded. Now, side effect 1 with finasteride is low sex drive and low libido. Now, this is something I experienced severely myself within about a week of starting finasteride at 1 milligram. And this is probably the side effect that is discussed most. Now, it's important to mention that for most it's temporary, but some it can last a really long time. For a little bit of context, my depression and low libido lasted up to 2 years. That is a really long time, and especially the age that I'd started taking finasteride at 19 years old, which is incredibly young when you think about it. And when you're that age, having low libido for 2 years when you're doing university, you're exploring your sexual side, you're maybe getting with girls, you're dating, you may be getting with men. That's really, really challenging. Imagine you go for a night out, you're clubbing, you meet someone on the dance floor, you're really attracted to them, maybe they go back to your place and you can't get it up. It's one of the most embarrassing situations to possibly be in. And I'll be honest, I thought this would never go. Fortunately, it did go, but I went through a lot of soul searching in that time. There was no actual cure to get me better. It was something that I just had to adapt to for a long period of time, and I had to think my way through different situations, especially on a night out. And yes, a couple of times I had to take Viagra. Now, no 19-year-old should need to take Viagra to get it up. Side effect number 2 is in relation to minoxidil. And with minoxidil, things can often get worse before they get better. Why is that? It's because of the initial shedding phase. Much like what you get with a hair transplant. So once you've got a hair transplant, within the first 3 to 6 months, you will experience a shedding phase where the hair that's been transplanted onto the top of your head actually starts shedding before it regrows. Now, this is really unnerving, and it's not spoken enough about with minoxidil, but it's a really, really important side effect to be mindful of. Now, it is normal, but it's very hard to deal with mentally, and especially if you're not made aware of this information, it can be really unnerving and it can make you think that the actual medication is actually working against you rather than with you. So this is usually temporary, but it's something that you need to prepare yourself for mentally. Now, side effect 3, and this is a big one that I experienced for a long time. Brain fog. For a long time. Brain fog with finasteride. Now, the best way to describe this is basically feeling mentally off. You can't think straight. You lose a sense of clarity in your thought process. It can affect you at work. It can affect you in your education. It can affect you in social settings. I found it affected my energy levels as well. I was getting brain fog. I was getting brain fatigue, and I was just getting physical fatigue. And I think that was a whole part of the picture. I think because my brain wasn't mentally there, or as not as much as it used to be, it just started affecting me physically as well. And anyone who wants to learn more about that, Google the mind-body connection, and it's full of information, case studies, MRIs showing this exact phenomenon. Now, the problem I have with the current label around finasteride is it doesn't actually mention brain fog, but go onto any of the forums around finasteride and you'll see it's a very, very common side effect. In fact, too common for it to be just a chance happening. And it's something that's been discussed in these forums and in the media for a long time. So if you are someone who's more sensitive to medication, you may just find that this hits you harder than you expect. Ignore the fact that it just says 1 milligram per pill for the time being, because 1 milligram of this stuff, especially if you're sensitive to medication, can pull a strong punch. Now, side effect 4, and I'm going to mention 2 side effects in this, is scalp dryness when you apply the actual topical solution, but also heart palpitations. Now, I know that sounds really scary, but it will make more sense once I explain why a very small proportion of people do get heart palpitations. And that's because minoxidil was originally developed as a blood pressure medication, much like finasteride was developed as a prostate medication. These drugs were not designed to treat hair loss. They were both discovered as actually being useful for dealing with hair loss once they'd been designed and put out to market for other conditions. And this is very, very common in pharmaceuticals. To give you a classic example of this, let's take the case study of Ozempic. Now, Ozempic was not designed for weight loss. It was actually initially approved as a treatment for type 2 diabetes in adults because it helps to improve blood sugar levels when used in conjunction with diet and exercise. After a period of time, they started using it on people who had obesity, and they found that obese people were losing loads of weight with it. So it wasn't designed for that purpose, but it's been found to be effective for that purpose. So going back to minoxidil and the heart palpitations, I'd thoroughly encourage you to speak to whoever you're consulting regarding minoxidil. They may actually ask you to go for a lower dose, especially if you've got any sort of blood pressure issues. And the final side effect I want to discuss in this video is about dependency and long-term use. Now, if you stop either of these medications, the benefits stop. For me, I didn't really receive much benefit from either of them. I just got a load of side effects. But a lot of people have reported stopping either medication and losing all of the benefits that I gained. So finasteride, it might be massively reducing the progression and the amount of shedding that you're getting on the top of your head. For minoxidil, you may have regrown a very small amount of not good quality hair on top of your head. You'll lose that too, and you'll go back to where you were before starting the medication. So if this is something that works for you and you don't get side effects, you are on this for the rest of your life until they find some magic cure for hair loss, which at the moment is not in the immediate pipeline. So it's a lifelong commitment. It's a financial commitment, so you'd better make sure that you're prepared for that. Now listen, these medications do help a lot of people, but what they do come with is a side effect profile, and for some of these people who experience the side effects, including myself, those side effects last a long time, and you don't know if they're going to disappear. For some people, they haven't gone yet. So if you're not comfortable taking medication, or if you're uncertain around whether you'll experience side effects and that's something that concerns you, then a hair system could be a legitimate alternative for you. So if you're curious, I've made a free video called 5 Mistakes Hair System Beginners Make and how to avoid them. And trust me, it's essential viewing before you dive in. And if you've watched that and you're ready to explore hair systems, Libido is where I get mine. And they've given me a free, reusable 15% discount just for my audience. The link and the code are in the description box below. And now I'm going to end this on a positive tone because I don't have anything against finasteride or minoxidil, despite the fact that I did experience side effects with them. They do certainly help a lot of people. My channel is all about authenticity and transparency, and that's why it's really important to know that finasteride and minoxidil are certainly not for everyone, and they come with their own list of side effects, and it's something which you will need to take for the rest of your life. So it's important to consider that and just explore what works for you. If you want to learn more about what's happening with finasteride in the news at the moment, you might want to check out this video that's popping up on the top of the screen. And if I want you to take one thing from this video, is that medications aren't your only option. You need to explore what works for you. And I want you to hit like if you found this video insightful or helpful, subscribe for more content like this, and I'll catch you in the next one.